There was a lot of events that happened, my father dying and me preparing to go to the funeral in an abandoned building really had a big effect on my change and my need for change.
I had goals. I knew what I wanted to do. I just didn't know about how going about it.
I had a lot of anger. I was really lost. I didn't really have a sense of direction. Wasn't really even taking it day by day. I was just kind of just hanging out and skateboarding and smoking pot.
I didn't know where to run to. I didn't know where to go, what to do, how to respond, how to react.
At Care Plus, we recognize that people who come to see us are in some form of distress or pain or crisis, and our goal is to make them feel helped. We want them to come away from the experience of being with us feeling that we have helped them solve their problem. We do that in many ways. We do that through counseling. We do this through psychiatric services. We do by meeting their basic needs. Some of the people we see need homes. Some of the people we see need jobs. Others just need a place to play or recreate, and certainly a lot of people need companionship. So we provide all of those opportunities to them, and we hope that they feel, from our experience with us, that they feel helped.
I used to feel like an animal, and now I feel like a human. I can stand up for myself, and the possibilities are endless now. I can achieve anything now because, I have stability. I think it's like next to impossible for people to understand what it is to live in such homelessness, like such pain and depression and mental illness and drug addiction and broken heart.
William was a little hard to engage in the beginning, so we needed to consistently go to his house and meet with him and let him know that we were safe people, that we were there to help him. We knew he needed assistance with financial, food, doctors, his wellness, so psychiatry was another one, which was most recently something that we were able to get him involved in. So now he's willing to go with us and trust us that these are things that we are going to help him with and things that he wanted to eventually achieve for himself.
Care Plus has been really instrumental in my changes because they don't judge me. They treat me like a human. I don't feel like an animal like I did for about 10 years of my life. And they give me a chance to really see what's possible.
I was more stressed and I wanted to do so much and so quick. And the worker that I was working with taught me, you need to take things step at a time, day by day, and don't try to stress it. And once I realized that, it was a lot more easier for me to get on my feet and do what I needed to do.
The COPE outpatient program is a clinical program where I've been seeing Alyssa every week, and we talk about the different goals that she's working on clinically. So increasing effective coping skills and making healthy decisions, using healthier communication styles, increasing effective anger management, things like that.
I was always into school. I had a 3.8 GPA, I liked going out with friends. I did what I had to do. As time went on, that's when everything started progressively going downhill. And that's when my whole addiction kicked off. Being introduced to Care Plus made me realize that the stuff that they could offer to me was a new path for me.
What we help people with is we develop a treatment plan with them for when they're anticipated to be back into the community, for treatment, for housing, for benefits, for anything that you might need coming out of jail, because almost every time people come out homeless. And we will go to court with them, advocate in front of the judges. Usually it's here, sometimes municipal court. And we will advocate for the treatment plan to be put in place, usually with probation instead of a prison or jail sentence.
They were helping me get my license. They were helping me get my birth certificate, the necessary credentials that you need in life to get your life and become a normal citizen, if you want to call it that way. And now, when I realized that that could help me, I said, you know what, let me give it a try. Because I tried everything else in life, and obviously nothing else was working. Eventually it was either I was gonna end up in prison for a long time, or I was gonna die.
I feel like that was a turning point for him then, that he realized that something was gonna come of it this time, that he could do something different. and he had ID and he was a person and he could be a good person.
If somebody can't get themselves off their feet, they'll make sure they do it for you, just to give you that little kick that you need. And I know for me personally, that's what I needed.
Some of the programs that I run here at Care Plus New Jersey are integrated case management services. This is a outreach-based service that provides case management and coordination for mental health and primary care for folks who are living in the community who have experienced long-term or repeated hospitalizations and find it difficult to navigate the system that our healthcare industry provides to them.
Transition Services helps clients who are willing and voluntarily looking for support and help in the community. They're motivated, want to take one step at a time, one day at a time.
While I was in jail, this guy came up to me and says he'd like to help me out and give me an ICMS worker. And I said, that would be great. And I said, who will he be? He says, well, actually, it'll be me. And I'll help you stay out of jail.
He was having a very difficult time staying clean. He was decompensating and ending up back into the emergency room, hearing voices. And eventually we worked with him to try to get him to leave that situation. So we got him into the shelter. And then he was starting to do much better. He was going to the NA meetings. He was going to MICA at Bergen Regional. He was really active in his recovery, and he got a sponsor. And then we got him a voucher for the Shelter Plus Care, so he was able to become independently housed again in an apartment in Fairview, which I don't think he had ever even dreamed that he could do that again.
If I never met James that day, I would still be living in a drug house using drugs.
His future is much brighter. A couple of minutes ago, we were talking about NA, and he said someone bought the wrong token. They bought the 18-year token instead of the 18-month token. And he's saying, I have about 16 and a half years, but I'm getting that token.
I share with people what it is that Care Plus does and how amazing Care Plus is, and how they feel for their clients. It's a beautiful thing.
More recently, Care Plus has become a leader nationally in innovating the integration of primary care and behavioral care. You cannot separate the functioning of the brain from the functioning of the body. They're one and the same. So we believe that better health and better mental health is achieved by integrating the care of both mind and body.
We were very fortunate 4.5 years ago when we received the SAMHSA funding to build out this practice, which has fallen into line beautifully with the Affordable Care Act, which encourages the development of behavioral health homes for people with serious and persistent mental illness. So we're in a position right now where we'll be the first behavioral health home in the state of New Jersey, and we'll be able to provide all of the wraparound services for people that struggle with these issues, and we pull together all the medical, all the specialty care, all the behavioral health needs, working with the families, developing person-centered goals. If somebody doesn't want to do something, you can't make them. So it really has to come from the individual, with them telling us how they'd like to change their lives. Wellness is a huge component of getting better. So we help individuals identify what their goals are as far as becoming well for that person.
I have the great fortune of working with people who have had very difficult lives. Many have spent decades in state psychiatric hospitals because care opportunities were not readily available in the community. At Care Plus, we can truly say that we offer a full scope of care. We provide not only psychiatric treatment, we have in-house medical programs. We're in an exciting time in psychiatry. We've really changed from hospital-based treatment to treating people in the communities where they came from.
Well, all started when I was 8. My mother left me and my little brother at my grandmother's house, and that's when DIFUS first got involved. Through the years of group homes and foster homes and things like that, was on the streets for a really long time, involved with gang activity, drug use. Ended up in Division of Youth and Family Services again, and they forwarded me to here, Care Plus.
He was suffering from a variety and quite a vast majority of post-traumatic stress symptoms, including nightmares and transitional concerns and high anxiety and some depression when he initially came to us.
There really is no option for you to give up on yourself, because all you have is really yourself. You don't really have anyone else. And you need to find a drive and something that's gonna motivate you to continue and to get out of the hole that you're in. You know, when you're dealt a bad hand of cards, you gotta wait for your next hand, in other words. And you know, through Care Plus, they've helped me find drive, and they've helped me, you know, come into society and, you know, what it's like to pay bills, you know, what it's like to do regular everyday stuff.
The Children and Family Services at Care Plus encompass prevention services. So we work with moms and little babies all the way through children who are aging out of the system through the age of 22. We provide every service that we have seen in the community where there is a need. We provide in-home services, we provide outreach services, we provide outpatient groups, and even programs in the schools, because really it is the schools where the kids spend most of their day. So we want to bring services to them so that mental health services are accessible to all kids in the county.
School-based programming provides an opportunity for students to have access to a wide range of services in a really nice, non-stigmatizing environment. Services include counseling for students and their families, recreation activities and events, prevention programming around substance awareness, violence prevention, relationships, and all kinds of other things to help students get through school successfully.
I am a completely different person. I used to be the little kid that would sit by themselves at lunch, but now I am the one that goes out and starts talking to people. I love interacting with my friends and standing up and actually helping other kids become themselves.
I know that I can always come here and I can always ask them questions about anything that I need answered. And it was a really good time. It really helped me through my high school having the Falcons Lounge here.
Care Plus school-based programming is unique because it's connected to Care Plus as a whole. That means that students and families have access to all of the services that Care Plus offers, including 24-hour crisis intervention and groups that are available through the Care Plus system.
I learned how to talk my feelings out, communicate instead of stuffing all my anger and pain inside, and to let others in, you know, to let people help me, and I love it. Every Tuesday I can't wait to come here and just have my little chit chat with Melissa. We'll do a project together and we'll just, you know, it kind of clears my head. I look forward to it.
There's a wide opportunity of things that students can do in school-based programming, and it's all meant to help them achieve their goals and get through school successfully.
Care Plus Workforce Solutions was started out of the need to create employment opportunities for the disabled clients. So our first work track was Care Plus Laser Imaging, and that started actually in 1996 with two guys from Care Plus, two social workers actually selling cartridges out of the back of their car. And I came to the agency in 1998. And at that point, we started to really work on growing Care Plus Laser Imaging. We were just doing local businesses, and through a series of growth and events and marketing and sales, we landed one of our first large contracts with Merck Mecco. And from that point, we grew again and ended up landing with Access New Jersey. So as we built the capacity for laser imaging, we also built our capacity to start doing business with the state of New Jersey. From that point, we decided that we could create other opportunities through Access, and one of the opportunities that we created was our laundry. I think the benefit to our clients is what we offer in meaningful work. And we had one client who said to us once that we have no idea how it feels to be able to earn money, earn a wage where she could pay her bills, where she could pay her car note, where she could buy her groceries, where she could put gas in her car. And I think that's what we do here through Care Plus and through Workforce Solutions. We provide work opportunities for the client. Again, the wages are different than our special wages, and it helps some of them to actually move off of Social Security and live more independently in the community.
I'll never forget the day that one of our clients passed away. And, you know, when you say the word clients, it's kind of a clinical name, but our clients are not clients to us. They're family. And Joe Machendaro, sorry, but he was so touching that day when he told me about this client that had passed away and how part of our family had died and how we were going to miss this person. So to me, that's where the plus in Care Plus comes from.
My life has changed a lot for the better. I've learned to cope with, things that have happened in the past, also like with post-traumatic stress, depression, things along that nature, anger.
It's about being okay in my own skin, being able to look in the mirror and being okay with who I am.
Care Plus has done a lot for me in life. They have. Without them, I don't know where I'd be today. I really don't.
One of the very unique aspects about Care Plus is that our foundation fundraises dollars that go directly to our clients. They don't help programming, they help clients directly. So we fundraise to help our clients have medication assistance if they can't afford their needed medication. It helps housing so that we can keep families safe and stable. And it also goes directly towards their higher education needs so that if they have anything that they want to do in their life, we can help them directly with that. And that's why it's so important that people are continuously supporting the foundation because it goes directly to our clients.